Hello and welcome to Care Conversations, brought to you by Nurse Registry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're going to talk about something that affects millions of families across the country, caring for aging loved ones. It's one of those topics that can feel a little overwhelming, emotional, and honestly a bit confusing when you're trying to figure out what the best path forward is. If you have an elderly parent, grandparent, or loved one who's dealing with mobility issues or health challenges, you've probably heard the phrase, quote, skilled nursing facility, unquote, come up more than once. And look, those facilities, they serve an important purpose. But here's the thing that many families don't realize. There is another option that's becoming increasingly popular, and for good reason. It's called aging in place. Essentially, staying in your own home with the support of a home nurse. So today, I want to walk you through why home nursing care is not just a viable option for elderly patients, but it's often the best option. We'll cover what home nurses actually do, the benefits they provide, and why this approach to care is changing the way we're thinking about senior health. Let's start with the basics. If you're new to the concept of home nursing, you might be wondering, what exactly does a home nurse do? I mean, is it the same as a caregiver? Do they just stop by, help with daily tasks? Not exactly. They are trained medical professionals who provide nursing-level care right in the patient's home. And I want to emphasize that phrase, nursing-level care. We're not just talking about help with bathing or meal prep, and of course, those matter too. But home nurses provide legitimate medical treatments and monitoring. Here's a snapshot of what they can do. They handle wound care, think post-surgical incisions or chronic wounds that need professional attention. They manage medications, which is huge. We'll talk more about that in a minute. They also provide specialized care for conditions like diabetes, dementia, Parkinson's, Alzheimer's disease, things of that nature. They administer injections and even IV therapy when necessary. Basically, if it's something you'd expect to receive in a hospital or a clinical setting like that, there's a really good chance that a home nurse can provide it in the comfort of your home. Pretty nice, right? Now let's dive into why this matters so much, especially for our senior population. Now, here's a statistic that might surprise you. More than 13.8 million people in the United States, which is 28% of the population, live alone. And a significant portion of those folks are seniors. Now, living alone isn't inherently a problem. Many seniors are perfectly capable, independent, and frankly, they want to maintain that independence. But the concern is what happens when health issues arise. Isolation can lead to serious health risks, from depression to delayed medical treatment. This is where home nurses come in, and it's just an absolute game changer. Think about it. If you've lived in your home for 20, 30, maybe even 40 years, that space holds memories. It's where you feel comfortable, where you know every corner, where your favorite chair sits by the window. Now, think about leaving that behind and moving to a facility, a foreign one. I mean, it could be really nice. It could be the most beautiful facility in the world, but it's foreign to you, it's cold, it's clinical, and it can be heartbreaking for seniors. Home nursing services provide what I like to call the perfect middle ground, right? You get to stay in your own home, maintain your autonomy, but still receive the medical care and attention that you need. You're not choosing between independence and health. You can actually have both. And honestly, that freedom is priceless. I mean, what would you want in your older age? It's about dignity, comfort, and quality of life. Those things matter just as much as medical treatment. Okay, so let's be honest for a second. We could all use a little extra support from time to time, right? And for seniors, that extra pair of eyes can make all the difference between thriving at home and struggling. One of the most valuable things a home nurse provides is medication management. I told you we'd talk about it again. If you or a loved one takes multiple medications, which, let's face it, a lot of seniors do, Keeping track of what to take, when to take it, and how much can genuinely become confusing. Miss a dose, double up accidentally, or mix the wrong medications, and you got a serious problem on your hands. Home nurses monitor medications to ensure that they're being taken correctly. They can spot potential issues before they become emergencies, things like signs of an overdose or dangerous interactions or increasing dependency on particular medications. But it goes even beyond medications. Home nurses are trained to identify health risks in general in the home environment itself. They'll walk through your space with a clinical eye and notice things that you might not, like a loose rug. Well, that's a tripping hazard. Inadequate lighting in the hallway. A bathroom setup that could eventually lead to a fall. And here's why that matters. Falls are one of the leading causes of injury and death among seniors. A bad fall can lead to a broken hip, which can then lead to surgery, immobility, and just a cascade of complications. Unfortunately, some seniors never recover from falls. So when a nurse can help prevent the fall in the first place, that is huge. There's another benefit here that I don't want to overlook. Respite care for family caregivers. So what is respite care? If you're caring for an aging parent or a loved one, if we're being honest, you know how exhausting it can be physically, emotionally, mentally. Having a professional nurse come into your home or their home, it just gives you a break. It gives you peace of mind knowing, okay, someone qualified, someone trained, experienced is watching your loved one. So you can run errands, you can go to work, or you can just take a breath, knowing that they're in good hands. That support matters, and even caregivers need care too. Okay, here's a common misconception. Some families assume that if their loved one needs around-the-clock care or intensive medical supervision, a skilled nursing facility is the only option. Well, as we said, not true. Home nursing is available 24/7. You can have a nurse present at all times if that's what's needed. It's not like you can only have a home nurse between 8 a.m. and 6 p.m. and in those after hours, good luck. Hope everything goes well. Then no, that's not the case. But I could see why people think you need to be in that clinical environment if you do need around-the-clock care. But with the way that home nursing is, that's just not the case. Or if your loved one only does need occasional check-ins or very specific treatments, you can arrange for visits on a schedule that makes the most sense. But here's what really sets home nursing apart. It's one-on-one care. In a facility, even a great one, nurses are responsible for multiple patients, which makes sense, right? They're doing their best, but naturally their attention is divided. They've got call buttons going off, multiple medication schedules to manage, and a full caseload to juggle. But at home, the nurse is there for you or your loved one. Their entire focus that visit or shift is just on one person. They can take the time needed to really listen, to notice those subtle changes in condition, or to adjust care plans as needed. That level of individualized attention is incredibly valuable, and frankly, it's what quality care should look like. Now let's talk about something that doesn't always get measured in medical terms, but it's absolutely critical: peace of mind. This kind of goes again with the respite care. When you have a qualified healthcare professional in your home, someone who knows what to look for, how to respond to emergencies, how to provide proper care, it changes everything. For the senior receiving care, there's comfort in knowing help is right there. They're not alone. They don't have to worry about what if something happens. They can focus on enjoying their day, staying active, and living their life. For family members, that peace of mind might even be more profound. If you're an adult child living across town or maybe across country, worrying about your parents' safety and health can keep you up at night. You're laying in bed thinking, are they taking their medications? What if they had a fall? Did they eat today? When you know that a professional nurse is there, even if you're not the primary caregiver, if you're just a family member, a sibling, a loved one, a daughter, a son, providing certified high-quality care with a clear care plan in place, you just feel that anxiety lift. You can just focus on being a supportive son or daughter or sibling and not a worried, stressed out caregiver. It's the ultimate quality of care, not just medically, but emotionally too. All right, let me wrap this up by saying we all know every situation is different. There is no one size fits all answer when it comes to elderly care, right? Some people do need the level of support that only a facility can provide. And that's okay, that's understandable. But if you're weighing your options, I want you to know that home nursing is a legitimate, effective, and in many cases, superior choice for many seniors. It allows them to maintain their independence and dignity. It provides professional medical care tailored to their specific needs, and it just brings a sense of peace of mind to families in the comfort of their own home, the same place they likely have spent decades of years of their life. And it offers crucial social connection that can make all the difference in someone's quality of life. So, if you're considering this option, I encourage you to reach out to a reputable nurse staffing agency, like Nurse Registry, for example, if you're in California, and have a conversation. Ask questions. Talk about your loved one's specific needs. Can they help with that? Are they the best fit for that? Find out what's possible. Because here's the truth. Aging doesn't have to mean losing your home, your independence, or your sense of self. With the right support, seniors can thrive right where they are. And that is what good care looks like. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit nurseregistry.com. But thank you so much for listening, and until next time, take care.